Welcome everyone to LEMD's live educational series. I'm LEMD's social media manager and tonight's host, Brenda Rios. We're so glad you're here. At LEMD, our mission goes far beyond telehealth. We're building a space for meaningful conversations, science-backed education, and personalized support to help you take confident steps toward better health and longevity. Tonight, we're excited to welcome back Dr. Jason, a board certified nurse practitioner and chiropractor recognized for integrating traditional medicine with modern evidence informed therapies to deliver comprehensive and whole person care. Dr. Pencek began his career in nursing before expanding into chiropractic medicine, peptide therapy, hormone optimization, and other longevity focused modalities. With over a decade of clinical experience, and a strong emphasis on GLP-1 therapies, he is dedicated to helping patients improve metabolic health, achieve sustainable weight loss, and build lasting wellness from the inside out. Jason, thank you so much for joining us again on this special evening. Tonight's episode is particularly special since it's launch week. But before we take a dive into that, can you please share a bit about your journey and what first sparked your passion for this field?
Yeah, I think I've probably said this a dozen times now, but I started peptide medicine, just kind of this in general, years ago. I was already practicing some longevity medicine, IVs, hormones, injections, and my friends really wanted steroids. They wanted the good stuff. They wanted that juice, and they asked me to get them growth hormone and get them steroids. And I didn't have any idea what the stuff was. I learned about it, but had no idea how to dose it or use it. I looked up growth hormone as the first Google search. Good old Google helped me find growth hormone peptides. And all of a sudden I see Sermorelin pop up. I'm like, what is this Sermorelin? I've never heard of this. So I start deep diving. This is, mind you, before ChatGPT was rampant. So I couldn't just ChatGPT what Sermorelin is. And I started just doing a lot of research. And one of my friends had a clinic, and she would help open up IV clinics across the country. She had an IV clinic in New York that was already apparently using some peptides. Thymosin Alpha-1 was actually one of them at the time. So she contacted the clinic. She said, can you send me some information? They sent her all these white papers, so just basically a bunch of research papers. I got 30, 40 research papers sent over to me, but no real protocols. It's just the research papers. So I started reading through these things and got really excited. I had no idea what peptides were, but they sounded pretty interesting. I found a seminar, one of the first ones in the United States being taught. And I went, and I've been going to seminars and learning and researching and then provide education for the last 7.5 years. And about 4 years ago, almost this year, maybe it's 3 years, 3 years, 4 years, I don't know, it's been a while. I started posting a video a day on Instagram, trying to help people understand medicine, mostly peptide focused, but also just in general how health works and what things might be useful. So I got into it accidentally because my friends wanted all the drugs, and now they don't work with me. They don't do anything for me. They all wanted the drugs, and then they turned out not wanting anything at all. So I accidentally fell into this, and now I've just been, doing the peptide medicine for quite some time now, and I've gotten, I've seen a lot of really cool things. In fact, the one we're talking about today is probably one of my favorite peptides I actually use in practice, even though whenever I make videos on it, the views are terrible.
Mm.
So it is definitely a difficult one to get people as excited about. It's not your GHKC, which makes you skinny, your skin pretty, or your GLP-1 where it's like I'm getting skinny, right? It's not like the fun ones, or GHRPs and GHRHs like testosterone and nipramorelin. It's not as fun or as sexy as that, but it does some really good stuff foundationally for the body. So this is one of my favorite peptides overall. I'm so glad Ellie has finally decided to bring it.
Yeah, and that's so interesting. I feel like we have come a long way just in the last few years too, where people are learning about these peptides. TA1 is new to me, but I'm
Mhm.
excited for it. I feel like,
Yeah.
yeah, it might not have the appeal of GHK, but I
No.
think I see it the same as like glutathione. Like
Mhm.
it's a spicy one, but I'm
Yeah.
excited to take. So
Yeah.
if you haven't heard yet, to our viewers, we just launched Thymosin Alpha-1, so we'll be taking a deep dive into that. So now diving in, I know you mentioned TA1 was one of the first ones that you worked with. So can you help explain what it is and what sets it apart from other immune supportive peptides?
Sure. Realistically, it is the immune supportive peptide in general. When it comes to the immune system, we have something called the thymus gland. It's right here on our chest. And when we're babies, it takes up most of our chest. As we get older, it gets smaller and smaller and smaller. And the thymus gland is really important because it helps work on adaptive immunity. So we have innate immunity, we have adaptive immunity. Adaptive immunity is all the stuff when you've got an illness and you're a couple of days in, your body's trying to fight it off. Okay, that becomes adaptive. Your body's trying to fight off whatever virus, bacteria you have, so you mount a defense against it. Your innate immunity is your white blood cells, your neutrophils and your basophils. It's like the white blood cell count you typically will see. You can do white blood cell count. This is the stuff that's trying to fight off the whatever's in your body, and before it's turned over to more specific antigen sensing. Like there's the first part of the immune system where it says, "Hey, something's going on. We got to raise the temperature. We got to turn the heat up, and you have to do something to get this out of us." And then there's this more specific that says, "Let's launch attack specifically for this certain thing we see there." Now, the thymus gland is what helps differentiate these T cells. Basically, they're cells that go in and fight off viruses. It's the big thing they do. And what we want to do is get our immune system to function better. So our thymus gland makes this thymosin alpha-1 naturally occurs. So just so you know, this is a naturally occurring peptide, one of the few that we get to talk about. GHKCU is another naturally occurring one. But some of the peptides we use naturally occurring, some are synthetic. This is probably my favorite naturally occurring peptide because again, it helps the immune system. And here's the thing: the immune system is really important when it comes to inflammation. It comes to being sick. It's a real good longevity, you know, peptide for me. Now, what's so great about the thymus gland is again as it shrinks as you get older, so we lose this thymosin alpha-1. So as you get older, thymosin alpha-1 levels go down sharply. They start to drop really significantly. This is why when you get older patients, you know, they're getting more sick. You have your older people, 70s, 80s, who are going to die from things like pneumonia, viral infections that might hit us or bacterial infections that might hit us at a younger age are really going to wipe someone out that's older because again, the thymus has shrunk this gland. Now, I will say growth hormone releasing hormone, growth releasing peptides such as testosterone will increase the size of the thymus gland. We have studies showing growth hormone can actually grow the thymus back some. But the caveat to that is it's still not going to work as well as it did when you're younger. You're not going to get that full size back. You are losing thymosin alpha as you age. When you're sick, you use thymosin alpha-1. When you have an autoimmune disease, you're using a lot of thymosin alpha-1. These are all things depleting thymosin alpha-1 levels. So for me, thymosin alpha-1 is basically going to help work on immune intelligence. It's going to make your immune system smarter and know what to go after even better. And so when you throw it in there, it can make a much better defense for your body against any kind of basically infection going on. I'll use this in my viral patients that have post-COVID or any kind of viral infection if they've had just come off of it. I use this in my patients that have any kind of bacterial infections. I'll even use my mold in patients. And I can say it's not great against mold. It's not amazing, but I'm still trying to improve the immune system overall. And this is something I do to help that. Even though it's not directly helping improve mold, I do use it in these patients. So pretty much anything immune related, if I see an immune condition going on, including autoimmune, I'm saying this is one of the best places to start. So think of this as something we can do that enhances the immune system, recognize, coordinate, and then mount a defense against anything incoming. This is what thymosin alpha-1 really helps do.
Now, building on that foundation, how does TA1 influence immune signaling pathways?
So it ups regulates what's called T cell differentiation. So it puts the T cells into different pathways of how it's gonna what it's gonna turn into. So what it's really working on is helping make this T cell. This is what fights off these infections and viruses specifically, and finds the things it needs to find, tags them, and grabs them and gets them out. So the whole point of this thymosin alpha-1 is for the immune system to know and recognize um, foreign objects, foreign cells. What's this foreign thing in here? What do we do with it? Now, here's the thing: when you get a virus, you have a basically, sense to this virus the rest of your life. This is why people get colds every single year. There's way many different versions of cold and flu, these viruses that come out there. There's tons. That's why every year they have the flu vaccine, right? There's a different flu vaccine every year because it depends on what might be coming out. You don't get the same flu technically twice. Um, you can, but it's you get a faster response to it. Once your body has sensed something, it's found some kind of foreign object, it finds it and has a ability to clean it out, has a T cell for it, it's now gone. And now you have these T cells that are stored somewhere in your body, basically, using the lymph nodes. And what they do is look for this stuff. They're monitoring. So what Thymosin Alpha-1 is helping increase the monitoring system. And then when something comes out, it's a fast response. So what we care about, right, is how fast can this response be? How great can this response be to this? We want faster responses to any kind of foreign invader, to infections. And we also want to have, a larger defense. So those are the two things that really Thymosin Alpha-1 does. But on the other side, it shifts the pathway from adaptive to innate. So we talked about this adaptive and innate side of the immunity. It can go back and forth between this. When you have one side heavier than the other, you have autoimmune disease. When you have the other side too heavy, you're going to get sick more often. And we want to balance this out. So we don't want people getting sick too often. We also want autoimmune disease to run rampant in the body. And Thymosin Alpha-1 helps just kind of makes the immune system more efficient. So think of this as your immune efficiency driver peptide. If you want to improve your immune system and you want to make it as efficient as possible, Thymosin Alpha-1 is where it's at. It's not going to send your immune system into overdrive. This is what we fear, right? We take you and put you on something like Thymosin Alpha-1. Is my immune system going to be put on overdrive and it's going to fight off everything? And I'm going to have a large reaction from being on this by an autoimmune disease. It's not what we see. What we see is Thymosin Alpha-1 bringing down inflammation and helping, again, calm the immune system and helping the body either fight something off or even bring down the immune system if we have something like lupus, for example. If you have lupus or something, to that level with autoimmune, it's going to help the immune system, start saying, hey, don't come after ourselves. Don't fight ourselves. I use this in my thyroid patients. If I have Hashimoto's, I'm using Thymosin Alpha-1. In my lupus patients, my RA patients, if I have an autoimmune condition, I'm going to Thymosin Alpha-1 as an option, something to use as an adjunct to help treat this. And then the same note, if I have a long COVID patient or a COVID or viral infection, Thymosin Alpha-1. So I'm using it for both sides.
Mm.
Anything that's immune related, I'm saying, hey, Thymosin Alpha-1 is really where I want to go to help improve the system without overacting or turning the system up too high and causing some kind of major reaction, again, especially in autoimmune patients.
And what if this question came in? How does it help for long-term tick-related illnesses like Lyme disease? I know you mentioned thyroid issues like
Yeah.
Hashimoto's and
Yeah.
COVID.
So
Mhm.
so yeah, so anything, I just want everyone to understand if you have an immune condition at all, period. I don't care what the immune condition is. I don't care what you see that might be immune related. I am using Thymosin Alpha-1. If you have Lyme disease, Thymosin Alpha-1 is going to help calm the immune system down. So what it's going to do is it's going to we're going to talk about inflammation here. It's going to turn down NF kappa beta, which brings down TNF alpha, interleukin 1, beta, interleukin 6. These are inflammatory cytokines. They go up in infections, they go up in autoimmune disease, and it's going to calm everything down. So what it's going to do, I use it in my Lyme patients now. If I have a Lyme patient, Thymosin Alpha-1 is 100% part of the protocol. It's going to help the immune system mount a better defense and just help calm everything back down. What we want to do is bring inflammation down, and Thymosin Alpha-1 is really good at that, especially if you're chronic, chronic illness patients. If you've had, chronic illness or chronic infection for a while, Thymosin Alpha-1 helps bring that whole, chronic overactivation down. And that's what we want to do. Obviously, if you have Lyme disease, your body's been fighting this off for years, and it's clearly not getting rid of it. It's still there. Well, Thymosin Alpha-1 helps calm that down so you can mount a better defense against whatever infection you might have. So again, Thymosin Alpha-1, I cannot say enough good stuff. Today, actually, I don't know why. I think I had like 12 patients today in practice. I want to say out of the 12 patients today, I saw blood work for everyone. I want to say 10 of them had low white blood cell counts. And I've seen this with everyone. Everyone there today got Thymosin Alpha-1. If I see low white blood cell counts, I'm always telling patients, hey, you have maybe some kind of immune issue, right? My first thought is if you have a white blood cell count that's low, you've just had an infection. Even if you didn't feel it, that white blood cell count is now low because you fought something off. It usually goes high first and then drops back down. So every one of these patients I saw today, multiple I saw, had an infection. Some of them didn't know it. Some of them did know it. There's other labs to correlate this to see, but every one of them I said, hey, Thymosin Alpha-1's a great option. Like you should be using Thymosin Alpha-1. Personally, I take Thymosin Alpha-1 twice a year for a month, every single year, because I want my immune system to work better. Right now in Chicago, it is cold. It's very cold, we're in the teens right now. And so again, when you get to this temperature, you're cutting around more people, you want to stay warm, your infections spread more because we're more indoors. And I'm taking during the season, right? This is the time I see Thymosin Alpha-1 being the most useful, at least for me. And these patients, again, I had all these patients coming in. They were sick in the last few weeks because the holidays just happened. They're around probably more sick people. So they had, problems with their immune system, couldn't find anything off. So if I had given them, if I had my way, I would have had all these people start taking Thymosin Alpha-1 beginning or mid-November and take it all the way to the end of the holidays because no one was sick during the holidays. It's not a fun feeling. And Thymosin Alpha-1 can help reduce the time you're sick as well as help clear out kind of infections that you might see or might have.
So we covered the immune system. How about
Mhm,
cellular
mhm.
communication? How does TA1 help
Yeah,
support cellular communication and long-term cellular balance?
yeah. So it improves like the immune system crosstalk, the immune system talking to itself. So what it's going to do is help the immune system talk to other parts of your body. It's going to reduce this immune exhaustion too. So you just mentioned Lyme disease. So Lyme disease, chronic Epstein-Barr virus, long COVID. These are immune exhaustion type of illnesses, right? Your immune system has basically fought off as much as it can, and now the defense. Now it's like I'm done. I can't do anymore. I'm still trying to fight. I just can't do anymore. And thymosin alpha-1 helps the rest of the body again bring inflammation down and helps its exhaustion get better. So now your body can say, "Oh, wait, we can mount a better defense." This is like bringing the backup in. Hey, we can bring up the backup and help fix whatever's going on. So when it talks about the cell communication, we're trying to do is chronic stress and aging. We see lower levels of TA1. Now, this TA1 is basically affecting how our body handles incoming kind of infections. So for me, thymosin alpha-1 is my major immune modifying peptide. And again, it's not sexy. This isn't your GHKCU. But when it comes to, hey, I don't want to be sick. I don't want to be chronically inflamed. You have a high stress job. You've been really stressed lately. The stress has just been killing you, right? And we all understand with stress comes typically people get sick more frequently. And this is helping bring the inflammation down. Again, I can't stress this enough. Thymosin alpha-1 for me is an anti-inflammatory. It works very well. It's not working as well as your GLP-1s. Those are like my top when it comes to some kind of inflammation. But when you have any kind of illness going on, it's going to see some inflammation. Here's a really good example. Anytime you see inflammation markers like CRP raised in the body, so this is one of the most common inflammation markers that we see. CRP, HSRP. CRP goes up when you have an infection, skyrockets. So we want this number below 1 typically. If you have your doctor run this, usually it's really low. When you get an infection or you have a chronic, illness, or for example, you have, an autoimmune disease, this number can skyrocket. I had a patient today who had a number of like 17. So 17 times higher than what I wanted to see. What's thymosin alpha-1 do? It helps bring this inflammation down. These patients come to me like, I don't feel good. I'm inflamed. And again, this is post infection, possibly, or maybe even, with some kind of autoimmune. And we see these inflammation markers come down. I see my CRP come down. So I can't stress enough, even though we don't think that this is as cool as some of the other peptides, this is something I want to tell people like I'm using for my autoimmune patients, maybe year round, nonstop. For my older patients, my mom, for example, I put on thymosin alpha-1. She's 79 right now. She's been on for the last 3 years. Hasn't come off. I won't take her off. Why? Because again, it goes down sharply as you age. And I don't want to get an infection and be sick and have something happen to her. So anything that can do to reduce, infection or help the body fight anything off, is going to be useful. And again, this is going to work with other cells. And when your immune system interacts with everything, the immune system's going up, inflammation goes up, which is talking to the parts of the body and saying, hey, inflammation goes up, that also increases stress. If you have chronic inflammation, you also can have chronic stress just from that. So bringing this down is going to help, again, kind of across the board, any sort of inflammatory system issue, again, if it's immune related.
And you mentioned that you take it just a few times in the year
Mhm.
around this time of the season. And this ties into one of the questions in the chat. Is this peptide one we can just keep in on hand in case we get
Yeah.
sick, or is it
Mhm.
just for prevention? Can someone who's maybe already healthy just take it as part of a normal protocol?
Yeah. Oh no, 100%. Yes, I 100% agree. It should be. First off, you should have a bottle in your house at all times. This is like my emergency kit. I have Thymosin Alpha-1 at home. When I use a month of it, I bought another one. I make sure that's always there. Now, the reason for that is when you do get sick, you don't have to order the stuff and wait for it to show up, right? You don't want to be like, I'm sick for 3 days. You want to have it on hand. What typically works, the way I'm using in practice, when someone gets sick, I raise the dose way up. We're doing this super high dose of it for a few days to help get the illness under control, and then I'm bringing it down to help kind of finish off the rest of the illness, maybe for another couple weeks. But then I'm also keeping Thymosin Alpha-1 around, just in general to do twice a year. So, and again, you can use it during your protocols. One of the first patients I used Thymosin Alpha-1 with was a guy who's getting chronically sick. So if you knew someone that's like, getting sick, maybe they're getting sick, once every few months, every 2, 3 months, you're getting sick. Thymosin Alpha-1 is something I'll prescribe and I'll use for that patient for 6 months. I'll put him on a long-term Thymosin Alpha-1. I've done this before. Again, my first patients with Thymosin Alpha-1, he was chronically ill. Every month, he'd have flu-like symptoms every single month for years. We put him on Thymosin Alpha-1 I ended up being like 9 months. He came off. He gets sick once a year now. His immune system came back online, and he stopped getting sick as often. I've seen this time and time again with my patients that don't have immune systems that work very well. There's another group of people that I get fearful for, the people who never get sick. So if you're someone who never gets sick, right? I never get sick ever. That's also bad. You're supposed to get sick every so often. Like that's part of what the body does. It's supposed to fight off illnesses. It's supposed to get exposed and fight something off. That is good for your immune system. So those people fear me. I'm also fearful for as well because I want them to get sick. So giving the Thymosin Alpha-1, actually I've seen patients who end up starting to get sick more frequently. Not, it's not like they're happening every month, but they go from I've never been sick at all for 3 years, and all of a sudden they're like, I got sick this year for the first time. What the heck? Well, we gave you something for your immune system to recognize the illness. Because here's the thing, some people's immune system can't even recognize there's something wrong. Thymosin Alpha-1 can recognize, find, and get rid of. You could have some underlying immune condition you don't even know about. Um, Another great example, I had a person I worked with a couple of years ago, and they were sick. They had like some kind of illness. I don't know what it was. I said, hey, we should start Thymosin Alpha-1. Let's get it going right now. We overnighted it, started on the patient. And what was really interesting is after they got done being better, they had bought 2 bottles. They were 2 months of it. They were a month in, and they said, you know what? It's weird. My run times have gotten better. I've noticed I'm running faster. I've noticed my base pace has gone up. I was like, oh, that's interesting. So I stayed on it for altogether for 3 months. By the time that second month was complete, they said, my base pace went up quite a bit. Actually, I was really surprised. They didn't even know anything was wrong. They didn't even know that they had some underlying immune or inflammation that they got rid of. The second month went on. They said their base pace was raised, but the third month they're like, I don't see any change. My base is still the same. I said, okay, you've done all you can for the immune system now. Now we can cycle off. But let's do this every, 3 months. It's probably run another month of this because again, their immune system was not recognizing, and this patient didn't even realize that they were having issues. So I want to tell people, you may not even realize that your immune system is not working as efficiently as possible, and this is it. Think of like the thymosin was the oil change. It's going to make everything work more efficiently. So you come in, you do this oil change, and now guess what? Now my immune system is actually working the way it's supposed to be. It's not going to turn things up. It's not going to overstimulate, but it's going to make things work as efficiently as possible. And I can't stress enough, the immune system is such a massive part of our body. We need our immune system, right? It's what helps mount the defense against anything incoming. And so what helps bring inflammation down. There's so many parts to what the immune system does. And having a peptide that works in the immune system and helps balance out this overreaction to maybe autoimmune and to infections is one of the most useful things. If I had my way, everyone on this call would be taking Thymosin Alpha-1 after we got off. Every one of you would order this stuff and try it and do a month of it and see what happens to your body. I cannot stress enough that Thymosin Alpha-1 has been something I use as a practice pretty much every day. I'm prescribing this. Now, my GLP-1s are number one. I'd say Thymosin Alpha-1 or BPC are my next top two sellers. And again, it's because I see so much use for helping the immune system function, throughout our lives.
And what about other benefits? What does T1 what is TA1's role in wound healing and tissue repair? But there was a question that also asked about how could it help athletes? Is
Mhm.
there any support recovery from physical or physiological stressors?
Oh yeah, yeah. I mean, you're my athletes out there. If you are one of those people that is overtraining, which is can be pretty common, this is stress to the body, to the immune system. Like I just said, I have this patient whose immune system was not functioning the way it's supposed to, and we gave them Thymosin Alpha-1 and helped improve their base pace. Their run times got better. So this is something that I want every person to be running yearly. This is one of these things I'm recommending. Now, do you have to be on it all the time for the rest of your life? Well, my older patients, yes. If I have a patient that's a little bit older, typically the 60s and 70s, I'm like, yeah, take this. Just make it part of your protocol. Go for it. Like it's your immune system. Thymosin Alpha-1 again goes down significantly during aging. It goes down with autoimmune and goes down during illness when you're sick. So any of those three categories should be using it. So I mean, who doesn't get sick, right? Or who doesn't, get older? This is a great place to use it. But if you don't even know that you're getting sick, right? If you don't know that you have an illness, like again, 10 patients today came in, white blood cell count all low. I would say half of them knew, were like, oh yeah, I think I was sick. I don't even know. Another half had no idea. They had no idea they were even sick. I'm like, well, the labs very clearly show that you were sick. Something was going on. I don't know what it was, but they didn't even recognize it. And not that that's a bad thing. Um, but also that maybe means tells me that your immune system's not working the way it's supposed to. You're supposed to get an illness, and then when you fight it off, have something happen. And this is where I worry because it means the immune system's not working well. Now, Thymosin is one of the things I also use in my cancer patients. Because again, when you go through cancer, you have issues, you maybe chemotherapy, maybe you do radiation. These things weaken the immune system. So Thymosin can help work on that. Thymosin has some studies showing it can prevent melanoma or can help fight melanoma. So to me, Thymosin is one of these very versatile peptides. And um, when you have a person who's training heavily, they're working out a lot, utilizing Thymosin Alpha-1 during those hard training sessions, from that time could be useful if you're going to run high rocks, or maybe you're going to go do a marathon, an Ironman, and you want to keep that body up because you're putting your body on some intense pressures. Thymosin Alpha-1 is really useful for that. It'll help reduce that chronic stress. At least that chronic stress is going to affect your immune system. And who you can't afford to be sick at this point, or you can't afford to have something happen to your body. Again, inflammatory markers are going to come down from this. That's the big one. You mentioned wound healing. It's not direct for wound healing, but again, it reduces inflammation and helps accelerate, tissue repair. So tissue repair does get better when you have an injury. This isn't your BPC type of, repair, or your thymosin beta 4, TB500 repair, or even GHK repair. But anything that happens with inflammation, TA1 is going to help modulate a little bit. It's not as strong as the other ones. It is something to add in. This is the one that I'm saying it is a good add-on to almost any protocol I'm using in a patient. I push TA1 so hard because, again, anything that goes on in the body with inflammation, I'm thinking immune. Something immune related is going on. There's something inflammatory. And I'll use TA1 for that.
Amazing. And going back to that, what you mentioned about cancer, that some individuals have been taking it because their immune system was compromised. Can they take it during chemo?
Yeah, that's something we can use during chemo. So TA1's hard stop is if you have someone with let's say you've had an organ transplant. You do not want to use TA1 after organ transplants because you're on immune modifying drugs. They're going to basically shut down the body from trying to recognize this. We don't want to use it during that. That's like a hard no. If you're on serious drugs to prevent your immune system from fighting itself, you don't want it for that. So there's some disease processes they're using really, really strong biologics, and you don't want to add it in the system to those patients. For my chemo patients, of course, I'm giving it to them. It's like an automatic. They're going through chemo and they're having their immune system wiped, like completely wiped out. This is not overacting. This is what we like about it. Think of thymosin alpha as if it's mild. It's mild but strong. It's not going to shoot all this stuff up and be like, I'm fighting my own body off. I'm gonna mount a giant defense against something. It's going to bring my autoimmune even worse. What it's going to do is make everything mild. It's going to bring again this ratio of TH1 to TH2, kind of brings it back to the level. And again, this is adaptive and innate, going back and forth. And when one side goes up, the other side goes down. It's like a teeter-totter. And we want level. We want our body to be able to fight off anything coming on. We don't want our body to fight off anything we have naturally inside of us, right? We don't want it to happen. When you have chemo and you have your body kind of being the whole thing's being wiped down, it's going to bring all of the levels back up. In fact, Thymosin Alpha-1 is really good for people out there that get vaccines. Thymosin Alpha-1 actually holds the vaccine. So let's say you've gotten a vaccine for the flu, for example, this year. If you take Thymosin Alpha-1 with that, it makes the vaccine hold better. So now you have a better response from that vaccine you were giving. So anyone that decides to do the vaccines, Thymosin Alpha-1 is a great addition to help hold any kind of vaccine that you end up getting. So yeah, I mean, during chemo, I would definitely be using it. I have used it during patients. Now, how much of it's going to actually help fight off the cancer? I wouldn't say it's like this is the drug I go to for cancer fighting, but in my cancer patients, one of the few peptides that can give and feel very safe with, because again, when it comes to cancer, cancer is very often the immune system's gone haywire. What happened is it hasn't found this cell that was dividing that had a problem. Your body didn't find it. This is an immune problem. And when you can make your immune system function better, guess what? There's a very good chance your immune system can find the cells that weren't supposed to be there and get rid of them. I'm not saying this is cancer prevention. Everyone should be on for cancer prevention. But again, in things like melanoma, where they found Thymosin Alpha-1 has actually helped reduce melanoma and helped treat melanoma. So there are some conditions we see cancer being very, very strong correlation with using Thymosin Alpha-1 and reducing cancer. So I'm all about using TA1 again, because anytime your immune system is working correctly, you're less likely to get cancer. Again, I'm not saying TA1 is going to stop you from getting cancer. Losing weight is a better option for stopping you getting cancer, but TA1 can improve the immune system and help you maybe find anything that might turn cancerous.
Now, what about people with teeth issues? This was a question that came in. I don't know if that's enough information. Uh,
Um, so if we're talking periodontal disease, maybe that could be part of it. For sure. I wouldn't say it's going to help your teeth. There is a peptide for teeth, hasn't come out yet. I think it's out of China. It's supposed to regrow teeth. So we'll wait on that one. Maybe Ellie will bring it out in 2028 or 2030. That'll be the new peptide we talk about. But for teeth in general, like it's, again, infection. Everyone think infection. If you think there's infection somewhere in your body, TA1 is the automatic thing. I had an argument with another, a doctor came at me. I posted about this, not Diamond one specifically, but I posted about something peptide wise. And the guy came at me. He's a big Instagram doctor influencer and was, basically chewing me out, saying peptides don't do anything. There's no research and, whatever. And I came back and, I was like, sir, you're a surgeon. And, Thymosin Alpha-1 post-surgery is great. Anytime I have a post-surgery patient, Thymosin Alpha-1, I use it a lot. So post-surgery action, and you have inflammation. Let's bring it all down. So he's a surgeon. I was like, why? You have talked about peptides. Why would you not use this one? And he started tripping me a new one and saying, it's good for viruses only. That's about it. And I was like, and I sat there and thought, no, there's good research on it actually treating bacterial infections. In fact, in a condition called sepsis, which is basically when bacterial infection takes over your whole body and can lead to death, there's good research showing that Thymosin Alpha-1 can reduce the sepsis load and actually help better outcomes. So I'm just thinking, here's this guy coming at me who's, very esteemed, has a lot of followers. He's probably a pretty good surgeon and still coming at me and doesn't understand how this works. And he's, arguing with me. And I'm thinking, look, here's the research article right here, sir. Here's a couple of these research articles in sepsis. So I think the problem with Thymosin Alpha-1 is that many people don't understand how important the immune system is. I think that's the big thing here. The education is your immune system is one of the most important and foundational things. I know we're skin. It's the pretty. We don't look weight. Like we're vain. We're all vain, right? Every one of us here is vain. We all want to look ripped, chiseled Greek god bodies. Who does not want that? Thymosin Alpha-1 doesn't do that, right? You're not going to come back and be like, wow, I look great today. My shirt's off and this Thymosin Alpha-1's really helped me look great. So I understand the appeal to it isn't as great, but I think what we miss is your immune system not functioning, chronic stress, chronic training, viral infections, bacterial infection, all this stuff affects how you feel day to day. And if you don't feel your best every day, you can't take care of your body the way you want to. Think of this, right? When you get sick, what are we all going for? I don't think anyone's going for the broccoli and carrots when they're sick, right? We're going for the garbage foods, right? Or they're high carbs, unhealthy stuff. Most of us are wanting comfort foods when we're sick, right? And when you're sick and don't feel good, that's what you go for. We have a peptide called Thymosin Alpha-1 that can help reduce the sickness, reduces time you're eating this garbage comfort food, which is only going to lead to infections getting more. You bring more sugar in, they feed off that. When you have something that can help do that and bring inflammation down and make you feel better, you can help get yourself to, eat better foods or to work out more or to do whatever you want to do, daily activities to make yourself feel better so you can live the life you want. So I cannot stress enough that if you have not considered trying Thymosin Alpha-1 as just a trial even, this is one of those ones I put all my patients I possibly can on it and do recommend again twice a year. So for teeth, short answer there, if you have an infection, for sure it's worth trying. I can't go beyond that. I don't know what else to do for teeth, but if you have an infection, sure, try it.
Thanks. And we're getting a lot of questions, and so let me take some of these. Maureen
Go right
asked,
ahead.
are there any drug interactions? Older clients are often on a lot of meds, and it seems they're denied a lot of peptides based on prescription use.
Yeah, like we just said, if you had an organ transplant, you can't do it. So they're on immune modulating drugs. If you're on heavy biologic immune modulating drugs, very often we don't want to give this to patients because to begin, we don't know what could happen. If you have the other thing is chronic flare-ups. If you have a massive autoimmune flare-up right now going on, I'm very questionable. Like I might start at a much lower dose. I'm going to give it to patients. I had a patient a while ago who had autoimmune encephalitis, which is basically fluid on the brain. And thymosin alpha-1 that one of the first peptides I went to. And that did not work well for her. I thought it'd be great. It's an option. She has an autoimmune condition and she was in a giant flare. And that did not work out well. The patient became worse actually by being on this. So I am cautious about my autoimmune huge flare patients. It's not for those patients, not the drugs they're on. For those patients, it's the flare. For the patients that are on disease modifying drugs, DMARCs, and are on really strong biologics, I would be cautious. If you're on a drug that's suppressing the immune system, do not use thymosin alpha-1. We're suppressing the immune system. We're not trying to make it work better. Again, this is an immune efficiency drug, a peptide.
Mhm.
So if you're on something that's going to stop the immune system from working, absolutely not. Ton of them, just a few of these out. It's not a lot, but you just want to ask, are you on a drug that suppresses your immune system? If you are, yeah, not a great thing to be on.
What about after a stroke? Question from
Uh,
Carrie.
yeah, post-stroke for sure. Um, this is not going to be as strong for me as using a BP757. I think that's a better peptide. If I had to put that in order, I'd pick BP757. I even use honestly GLP-1s that bring inflammation down. Those like that'd be two, but I'd still put it on there. It's going to bring some immune activation down, which is going to help lower the inflammation. So post stroke, for sure. It's not my top one or top two, but it will be part of a protocol when I'm looking at a post stroke patient, what I can do to help and bring inflammation. Again, think of this as an anti inflammatory, just not as strong as a GLP-1.
And let's go back a little to peptide stacking.
Okay.
I think we had mentioned you can take it with like along with glutathione or
Mhm.
GLP-1s. Is there any peptides that it shouldn't be taken with, or can it be stacked in the with maybe, like I said, glutathione or NAD, or
Yeah.
should they be taken separately?
No, no, no. Pair with all of them. NAD, Sermorelin, GLP-1, testosterone, yeah, all of them. So you think TA1 is going to stabilize immune signaling, right? NAD is supporting mitochondrial energy. It's going to support the mitochondrial function. The growth hormone peptides are going to work on repair. They're also going to support the immune function. As I said, growth hormone peptides, Sermorelin, testosterone are going to help grow that thymus gland back. So maybe you will be making a little bit more TA1. Not as much as we give you, right? We give you an excess amount compared to what you're making, but it's still going to be that. So you can stack this with your GLP-1s. And again, I said GLP-1s reduce inflammation. TA1's another one to reduce inflammation. So, hey, I want to reduce inflammation. I'm taking probably BPC, I'm taking GLP-1, and now thymosin alpha-1. Great stack. I want, overall, my, let's see, I'm an athlete or I'm just a person who wants to feel better overall. I'm sitting here saying, what can I do to improve my inflammation goals if I have some inflammation at all? Maybe the inflammation I don't even know that exists. I think this is where we miss a lot out with people and people we're talking to. You don't know you can feel better until you do, right? We live in this constant state of like, I think I feel good. Nothing's wrong. But we don't remember what it was like to feel like we did 10 years ago. We can look in the mirror and say very clearly, yeah, 10 years ago, but you can't look internally and say how, unless you're sitting there journaling every day. I woke up today and I did this and I felt like this all day. And you give a score. I used to have a patient scored his days 1 through 10. And unless you're doing that every day consistently, you don't realize the down, like how much you go down. And you get used to this chronic state of like overstress, chronic immune system overactivation, maybe chronic inflammation. Thymosin Alpha-1 helps bring these kind of, the chronic stress and inflammation kind of down. Not really the stress so much as the immune activation that's going on. And the chronic stress can lead to that, immune system not working as well. So I am pairing this in any protocol. And again, this is twice a year for me. Sometimes more, depends on what's going on with the patient, but at minimum, twice a year, every person should be doing this. You should have a bottle in your freezer. I put this stuff in the freezer, it's there. So, I get a bottle of peptides. Typically, I give it a year in the freezer and I'll keep it there. If I get sick or someone I know is sick, automatically, hey, I have TA1. It's my, again, rescue kit. Someone's got something going on, I can immediately give to this. Someone just had an emergency surgery. Guess what? I have a bottle of TA1 I can go use for them. This is the thought process I have. This is a emergency peptide for me to have in case something goes wrong. I think BPC the same way. I don't think GLP-1s is an emergency peptide. TA1 works almost immediately, starts working right away. So that's why I like it. And it can be stacked with any of the peptides that Ellie has right now. There's nothing that it can't be used with. And again, it should be part of a protocol that you do, and using it somewhat regularly intervals to keep your immune system functioning.
Mm. And what about, is there a potential risk for men post a TERP procedure with BPH?
Oh, no, not at all. Still not contraindicated. Totally fine. Your TERP tried TA1. I personally like to use it during my breast augmentation patients. This is something called LF37 because what I worry about is contracture. And contracture is a condition with breast augmentation patients, for people that don't know. It's when you get biofilm around the implant and it changes the shape of the implant and changes the construction of the chest. It looks this really deformed kind of issue. And Thymosin Alpha-1 could reduce that risk of contracture because it can reduce that risk of biofilm. Again, this is biofilm is like a, think it was like a kind of a bacterial infection around this area. So what I would tell patients is anytime you have any kind of surgery, consider thymosin alpha. It's part of my surgery protocol. I'm adding thymosin alpha in there. It is not, again, probably something people would notice as much as taking a BP757 or thymosin beta-4 post-surgery, but it will help them heal faster because inflammation will come down. And again, it reduces the risk of their infection post-surgery, which is, I think, the biggest thing that matters.
And once someone starts to take TA1, how long does it usually take for them to notice benefits? And if it's a peptide that they're just going to incorporate for their normal yearly, maybe peptide schedule, will they notice any benefits long term?
Yeah. Yes. So acute benefits typically 2 to 4 weeks in. Like you're gonna start seeing things 2 to 4 weeks in. When you have the actual change, the immune system, like structural change with the immune system actually functioning better, that takes about 8 to 12 weeks. So it takes 8 to 12 weeks to finally get to that like level where like your immune system is functioning the way it wants to. Everything's kind of chugging along like it should. You start to see improvements in the first few weeks. Again, when I have a patient that's actually ill, they have COVID right now. I am the dose we give in practice. I'm tripling that dose for the first 10 days they're taking it. And again, this is my infections. If you have a cold or flu, maybe I'm doing a higher dose for 3 to 5 days. And then I'm done because the illness is typically lived its course. But then I'm continuing the rest of that bottle till they finish it. So I'm raising that dose up, using a higher dose, and then dropping it down and finishing whatever's left of the bottle, and then saying, get another one. You need another bottle. So yeah, I am using this regularly at regular intervals, again, twice a year for me. But if I get sick outside of this, I'm using it. So it's not just that I am incorporating my own practice, but I take enough peptides. This is one of those things that's on my list. I definitely do more than, once a year, but it's not that I'm running every single day. It's not that you can't run every day. I have patients that stay on this chronically and don't come off. It just depends on the condition. I can't say my normal person is going to see a giant benefit from being on it for a year. We've had patients on it for that long. I've had patients who want to experiment. Then we take TA1, but they're taking it because they have some immune condition, not just taking because they want to have a better functioning body or they want to run a little faster, or they want to feel better. Unless you have an immune condition, something that's actually going on with the immune system, it's not going to make a massive difference past 3 months for most people.
And there's a lot of questions, so let me continue with some of these. What about blood clotting disorder, factor five?
Five lighting, yeah,
Leiden?
still fine. It's not a problem. Like there aren't, no, not a contraindication. You can totally still take TA1.
Mhm. Would TA1 or glutathione be better for someone with asthma?
Ooh, that's a good one. Um, it's a toss up. When it comes to asthma, that's going to be really big. That's for me, it's inflammation. I like glutathione a lot. I would say I use probably more glutathione in those patients because TA1's pricey. But at least in my practice, TA1's a little more pricey than a glutathione. So I'm always going to try glutathione first, see if it does anything, and then maybe switch to glutathione. So I'll start with TA1 for my asthma patients. Again, if I'm thinking there's some kind of relation to, is their asthma triggered by, I don't know, mold or mites or dust or pollen or some kind of allergy. If there's an allergy to it, for sure, I'm on T1. If there's just overall asthma, it's not connected to anything, then I'd say probably glutathione might be a better option overall.
Mm. And I know you mentioned TA1 helps with inflammation, so would it be beneficial for people with maybe who have arthritis?
Yeah, I use an RA. Not the most for regular inflammation from like your arthritic patients, it's not going to be major. Again, BPC is better for this. TB500 is better for this. Even a GLP-1 is better for this. This is low down there. This is for me, for inflammatory purposes, this is at the bottom of the totem pole. Try it because you want to try something like my inflammation's way better from the GLP-1. It's definitely doing better because of the BPC TB500. What else can I do? Add TA1. This is not a starter for inflammation for me. This is a bottom of the barrel for me. It's not going to work. It's just unless you have an autoimmune condition that's driving the inflammation, I don't see it being the major source of bringing inflammation down.
Now, are there any specific lifestyle habits like sleep, nutrition, or stress management that might enhance the effectiveness of TA1?
I don't know. Does sleep matter, Brenda?
Depends on the person.
I would say yes. Yeah, yeah. I hope so. Yeah, I think the answer is yes. Sleep is going to improve everything, right? If you get better sleep, you're going to have better immune function, period. I don't care how you cut it, that's going to get better. So, yes, sleeping better. Obviously, if you have a better, diet, right? We just had the food pyramid change just in the last, few weeks here, which I'm really excited about. More protein. What have you been preaching at LEMD for the last how many years? Eat more protein. If you have been on one of these calls at some point in time with anyone, I don't care who's been here speaking to you, we've mentioned protein. We're all saying eat more. We are chronically undernourished with protein. So yes, more protein helps the immune system function better. Better sleep helps the immune system function better. More exercise helps the immune system function better. Right? If there was a single driver to improve longevity, exercise would be number one. Number two for me would be sleep. Hydration comes after that. And all these things are super important. If you're not doing the lifestyle changes, these peptides are worthless. I can't stress that enough. I think I just made a video a few days ago about the GLP-1s and how a lot of people out there lose muscle mass. And then they come off the GLP-1s and they gain the weight back. This is the big thing that's been just an article came out. In fact, I think in December of 2025, discussing this and saying how people gain all the weight back, some of it. And my argument's always going to be, did these people eat enough protein? Here's the thing. If you eat enough protein and you control for protein as you lose weight, you can hold up lots more muscle mass. When you lose this muscle mass, you are going to lose your metabolism. This means you get to eat less food after you come off of GLP-1. It is not fun and a lot harder to do and manage. So protein is huge. Again, Thymosin Alpha-1, you need to have the adequate amount of protein for your immune system to work. You need the proper amount of sleep for your immune system to work. You need exercise for your immune system to work. Exercise helps drive the immune system. So yes, all these things paired with TA1 are only going to benefit, but they're going to benefit you across the board with any peptide. You can't out peptide a bad diet, poor sleep, and poor nutrition. I'm sorry, you just can't do it. I wish we could. We just can't. It doesn't exist yet.
So everyone still get your protein in and sleep.
Yes, please.
And I know you mentioned like it's not as sexy as GHK,
Mhm,
but I'm
mhm.
excited for this one. I'm definitely adding it to my peptide stack. So,
Yeah.
what excites you the most about the future of TA1 and its role in integrative and longevity medicine?
TA reframes immune care like towards like precision medicine, right? This is like your precision medicine peptide. Like you are sick, you have a peptide, right? There aren't. I can't think of many drugs other than like Paxlovid for COVID. There's a few Tamiflu drugs that like work specifically for different illnesses, and maybe we're coming out with some vaccines now to help some pretend against the flu or protect against things. TA1 is one of the few things I have I can give during any illness and feel like I'm really safe. Feel like I'm helping improve that immune system and make people feel better. And there is no one that's sitting here that wants to get sick. None of us want to be down. I am, every single season Brenda comes and I'm like, it's cold right now. I keep thinking, when am I get sick? When am I gonna get sick again? When am I gonna get sick? And my life is running at 100 right now. I don't have time to be sick. That's what we all feel. I don't have time to be sick. And if I had something I can do that would help modulate this disease process, my sickness, my illness, and cut down, I mean, I don't know, if you're sick an average of 5 to 7 days, if it got down to be 3 to 5 days, 2 more days, what could you do with that? When I just think of this extra time, 2 more days of not being sick and not feeling like crap, what could I do? And this is precision medicine that's finest. You have something that our body naturally makes that we can give to someone to help improve how the immune system functions overall. I cannot say enough good stuff. This is something that everyone should talk about. This is what everyone should be on. Again, I know people don't get as excited about it. But for me, I see a lot of people coming to me with immune problems. It happens so often. A lot of you people are coming into my office that just feel okay. And again, 10 patients today, with these white blood cell counts that are low. And half of them didn't know they were sick. I'm like, you are all getting TA1. Every one of you walking out there. Like, I'm doing a disservice if I don't give you this to build your immune system back up. So I think that this is important, as important to me as doing like the hormones of patients and working on metabolism. It's that important to me to get the immune system to function at its finest and best. So again, I can't stress enough, minimum twice a year for patients, pretty much across the board, unless there's a contraindication to being on it.
Amazing. There's just a lot of confusion in the chat with freezing it. I know
Yeah,
you
yeah, yeah,
mentioned you put it in the
yeah,
freezer. Can you clarify
yeah,
that
yeah.
a bit?
So let me flip this. Yes. So many of the peptides that we use, you get one freeze thaw. One. Guys, you put in the freezer once, you let it out, the end. That's it. You don't have to freeze it again. You're able to hold stability better by freezing a peptide, so it can last longer. It does last a little bit better than beyond the beyond you say the BUD we put on there. Again, if you're not using it, I will say there is some potency loss. Right, here's what happens with peptides in general: they break down. Peptides break down in general. The reasons why we have half lives of peptides in our body isn't because our body's hot, because we check this and our body's 98 degrees, right? If these things degraded in heat, really, they break down your body immediately. Your body's 98 degrees. What breaks them down is these different proteases and peptidases that break down in general the bonds between these peptides, amino acids. So it's not the heat that worries me more so than the actual, peptidases and getting these things in your body. Now, when it comes to actually keeping your peptides cold, I want them in the fridge as much as possible. When you come to the point that you want your stuff to last longer, for example, I don't know, let's say you used your GLP-1 and you got pregnant. It's a great example here. And now you're like, God, what do I do with this? I just bought it. I just got it. I found out pregnant, last week and it's here now. What do I do? You can't return it, right? This is a drug. What can you do? You can put it in the freezer and have it last for up to a year. It does not destroy the product. You get one freeze thaw and it can last about a year. Again, the potency is still going to go down in the freezer, right? There's still a clock that's ticking and you're still degrading this thing as it goes. But it gives you an option to keep it a little bit longer. So this is what I do with my TA1. I keep it there for the just in case. I, think LA's turnaround time for their getting their peptides out to you is pretty quick. But heck, if I get sick, I want to start it that day. Oh my God, I'm getting the sniffles. I don't want to have to go online and order. I want it already at my house, ready to go. Like I want it right now. I take out my freezer and I'm ready to go. So that's how I use the freeze thaw for a lot of peptides. Just in case I need it right now. It's that I'm using often. Again, one freeze thaw. That's all I can say.
Amazing. Thank you so much. I'm excited for this one. I always get sick. Literally every winter and every summer I get a summer cold. So
Mhm.
I'll definitely be adding this one. So thank you so much, Dr.
Welcome.
Jason, for all of this amazing information. We had a lot of people just even comment like this information is fire. So
I saw
the
something else. I saw one of the comment there. Someone I think commented about allergies. Yes, I use it in allergies. It's great for seasonal allergies. It actually reduces kind of the overall inflammation you get from that. So I do use in seasonal allergies for patients, by the way.
Awesome. And for anyone who wants to replay this, because there was so much information, the replay will be available tomorrow on YouTube and all top streaming platforms like Spotify, Apple Music. Again, Jason, thank you so much for all of this information. And to all of our viewers, thank you so much for attending. If you were invited by anyone to this call, please be sure to reach back out to them. So, again, thank you everyone and have a good night.